Hello everyone, thanks for joining us today. My name's Mickey Draper. I'm a health and safety consultant for THSP, and today's Toolbox talk is going to be on respiratory protective equipment, or RPE as commonly known. I'll jump straight in then. So RPE is used to protect workers from inhaling hazards, substances such as dust, fumes, vapors, gases and biological agents. If not selected, fitted and used correctly, RPE may provide a false sense of security and fail to protect the wearer. This toolbox talk aims to cover RPE types, legal requirements, correct use, fit testing, maintenance and storage. So the legal requirements then and the HSE's guidance. So under the control of substances hazardous to health, also known as COSHH, regulations 2002, employers must prevent or control exposure to hazardous substances, provide suitable RPE when exposures cannot be controlled by other means, ensure RPE is adequately maintained, cleaned and correctly fitted, and provide training and instruction to the users. HSE's guidance then, so HSG 53 covers the respiratory protective equipment at work and it's a practical guide. You've also got INDG 479, which is the use on maintenance of RPE. So types of RPE then. So there's two types of RPE. The first one is the tight fitting face sealing RPE. Yep, this is the one that obviously has to seal around your face. It relies on a tight seal with the face to work effectively. They tend to be disposable filtering face pieces. FFP1, FFP2 and FFP3 will be the ones that you commonly see in the construction industry. There's two types within that category then. There's the half mask, that goes over your nose and under your chin, and then there's a full face mask. Yep, so these tight fitting face masks then require face fit testing. We will cover a little bit about face fit testing later on in the toolbox talk, because I know it can be a bit of an issue in the construction industry at the minute, getting people to shave, etc. So the second type then is loose fitting RPE, which does not rely on a tight face seal. Yep, so your loose fitting RPE, doesn't require face fit testing. They tend to be a little bit more expensive, but it can be a common way to get around the old asking people to shave. And these are the hoods, helmets, and you've also got the powered air purifying respirators, or PAPRs for short. As I've said there, these do not require face fit testing, but must be properly selected for the task and the wearer. Face fit testing then. For tight fitting RPE, a face fit test must be carried out by a competent person before first use to ensure a good seal. There's two types of face fit testing. There's qualitative for disposable half mask respirators using test agents, for example, a bitter solution. And basically you put the mask on, they spray you with a substance, and then if you can smell it or you can taste it, it means you've not got a correct seal. Yeah, and then there's the quantitative for full face respirators using specialist equipment. Face fit testing is required for each make and model of RPE for each individual user, and if the wearer has significant facial hair, e.g. weight loss, gains, facial hair and surgery. Sorry, facial changes, that was, not facial hair. So if the wearer has significant facial changes, for example, he's lost a lot of weight, or he's gained a lot of weight, facial hair, or he's had some form of surgery that might affect the seal. Okay, RPE will not protect if there is facial hair between the mask and the skin seal area. Again, we'll cover that in a second. So just moving on to some frequently asked questions. So I, conduct construction inspections, safety inspections on construction sites. I do health and safety audits, and some of the frequently asked questions I get is face fit testing a legal requirement? The answer to that question is yes. Under the control of substances hazardous to health, Employers must employ the RPE provided to employees adequate and suitable. For tight-fitting RPE, this means it must fit the wearer correctly. Proven through face fit testing. Failure to do so may result in non-compliance and HSE enforcement. So the half masks, anything sealing to your face, it needs to be face fit tested by a competent person. So face fit testing is required, and it does require the people to be clean shaven as well, because you can't form a seal around the face if there's facial hair in between the skin and the respirator itself. How often should this be done is another asked question. So it should be done before its first use, and it's mandatory for every worker using tight fitting RPE. So RPE, if you're not aware, it does come in different sizes. I know they've got the one mask fits all, but people have different facial shapes, and they do have a small, medium, large, depending on the company that provides the RPE. So the face fit testing, it trains you on how to use it, how to correctly seal it around the face, and it also makes sure that you're using the correct size of RPE for that specific person. So how often should it be done? Yeah, we covered there before first use. We mentioned it before, but significant changes to a wearer's face, such as weight loss and gain, any dental work, facial surgery or scarring, growing or shaving of facial hair. Periodic reviews then, so how often should it be done? So the HSE does not set a fixed time frame, but many construction companies retest every 1 to 2 years as best practice, especially on longer term sites or where work is high risk. For example, silica, asbestos, wood dust, that sort of thing. Tips for site managers then. So keep a fit test record log and include checks as part of your routine PP and RPE reviews. For principal contractors amongst you, I'd recommend that you request the face fit testing before subcontractors come on site, as just a means that they're already prepared, and then you don't get that kick up when they do come on site and they haven't been face fit tested and they don't want to shave. If we're requesting it before they be on site, they know and they're aware of what the requirements are in terms of face fit testing and the use of RP on site. Alternatively, they've got the more expensive option, albeit, but you know, the hooded mask and the air fed mask as well, which don't require face fit testing but do cost a little bit more money. Yep, so facial hair, refusal to shave then. Obviously you can't make people shave. So RPE cannot provide an effective seal over facial hair. Even short stubble compromises protection. If operatives refuse to be clean shaven, you must consider alternative RPE that doesn't rely on a tight face seal. For example, powered air purifying respirators with hoods. You should document discussions and decisions and involve HR or management if refusal persists. I can't tell you how to enforce this rule. As a health and safety consultant, it's a requirement by law and it's mandated across all industries. So it's down to you how you manage that on site. Remind workers that duty of cooperation under the health and safety law requires them to comply with the protective measures. Moving on to the fitment and usage then. So always check the RP before use. Inspect for damage or wear. Conduct a pre-use seal check every time you put it on. Ensure the straps are correctly positioned and masks sit snugly. Never wear RP around the neck, on the head, or partially donned. Do not remove RP in contaminated areas. Yep, so just if you're going to take the mask off or you need a break, just leave the area where there's a high volume of dust, if that's the area you're using it for. Take the respirator off, clean yourself off, and then put it back on once you step back into that area. Maintenance and cleaning then. So reusable RPE must be cleaned, inspected and maintained regularly. Should follow the manufacturer instruction and record all maintenance activities. Replace filters as per service life, or breathing becomes difficult. Yeah, so if you're struggling to breathe, if you've got the ones that have got canisters fitted, change the canisters, because they might become obviously blocked because they're blocking out all the particles in the air. Only trained personnel should carry out RPE maintenance. Yep, so when you get provided with your RPE, you should be trained on how to use it, how to maintain it, and how to clean it as well. This should come with the manufacturer instructions. Storage then. So storage RPE, store RPE in a clean and dry place away from contaminants and direct sunlight. Use sealed bags or containers to prevent dirt or damage, and do not store RPE in toolboxes or exposed areas. Training and competence. So workers must receive training on when and how to use RPE, limitations on RPE, how to inspect, wear, clean and store, and what to do in the case of a malfunction. This is normally done just like now in the form of a toolbox talk. The employee responsibility then is to wear the RPE as instructed and ensure it fits properly. You should maintain the RPE in condition and report any defects. Attend face fit testing and training, and never make unauthorized changes to RPE. So I mentioned a lot about obviously the RPE. What I want to do now is to spend a little bit of time well, just going through quickly and the illnesses caused by not wearing RPE, mainly within the construction industry. So the first one we got then is silicosis, and it's caused by inhaling respiratory crystalline silica, or RCS for short, from cutting and grinding concrete, bricks and tiles. It's progressive and it's incurable lung disease causes scarring and breathlessness, so struggling to breathe. You've got chronic obstructive pulmonary disease, or COPD, which is linked to wood dust, silica and fumes. This includes chronic bronchitis and emphysema. It causes long-term breathing issues and reduces your lung function. Asbestosis then, mainly for people that's obviously stripping out asbestos, but within a lot of older buildings. So any building that predates 1999 tends to have asbestos containing materials in it, which, you know, is a hazard in itself. Okay, so asbestos is caused by inhaling asbestos fibers, especially during refurbishment or demolition work. It leads to severe lung scarring and increased cancer risk, and there is currently no known cure. Occupational asthma, so it's triggered by isocyanites, or sometimes it can be spray paints, it can be wood dust, it can be chemical vapors. It can become permanent if the exposure continues. Lung cancer, so strongly linked to prolonged exposure to silica dust, asbestos and diesel exhaust fumes. Often develops after years of exposure, and there's not many symptoms to catch it early on. Mesothelioma then, so it's a rare but fatal cancer almost exclusively caused by asbestos exposure. And it's typically diagnosed decades after exposure. So asbestos is the silent killer. It can take up to 35 years to kill you, but it does kill you. Okay. Right, I appreciate everyone tuning in. Thank you very much for your time today. Now that concludes today's Toolbox talk on respiratory protective equipment, or RPE. Thank you.